Hi everybody, welcome to week 7 of your nursing education practicum. Good to see you again. All right, so this week we're focusing on competency 4, which is curriculum design and evaluation of program outcomes. This again is a huge competency. Curriculum design is fun, intensive, time-consuming, detail-oriented. It's very challenging. Let's just think about a curriculum. You've got to include things that students need to be a nurse. You've got to include CUSIN competencies for safety. You've got to include Joint Commission requirements, accreditation requirements, components of your university's mission and vision statement. You've got to level these things out. There's just so many things that go into it. But if you do have a chance to write curriculum, plan curriculum, and that could be in academia, that could be maybe putting together the curriculum for a new unit that's opening, a new procedure that's going to be done at your facility, a nurse residency internship and orientation. So if you have a chance to develop some new curriculum, you can do it. It's going to be time consuming, intensive, but it's fun. All right, let's look at a couple things. First of all, when we're thinking about, this goes back a little bit to what I said a minute ago, but who are the stakeholders when I'm developing curriculum? We got to think about this kind of broadly. The student, the school, college, university, whatever, employers, accrediting agencies, patients, providers, community members. There's a ton of stakeholders. So when you've got a project and you're having to, let's say, revise a curriculum, develop a new curriculum, it really helps out to start with a large group of stakeholders to at least get some opinions, some ideas. Hopefully you will narrow that down to a small working group, but you don't want to miss out anything that's important to a particular stakeholder group that you find out after you've spent a whole bunch of time working on curriculum. When I was a dean in an ADN program, I had an advisory panel, and this was an ADN program, so I had people from local hospitals. I had somebody who taught at the BSN and master's level. I had a gen ed person there. Who else? Just a bunch of people. So, and then we usually met like twice a year. So as I was thinking about changes, directions to go, I would be able to run it by this group and get some feedback. And it was really interesting because they were all looking at it from different perspectives. They could also tell me about trends in their areas that I would maybe need to consider. Okay, so it was really cool. All right, the other thing about curriculum, there is always new stuff coming out, right? When I was looking at curriculum planning back in the day, so some of the things, we had a neat curriculum set up, and then there was a mandate to really put in more about geriatrics. Then there was a mandate to really put in more about genetics and nursing's role in genetics. And then more of our graduates were going straight into critical care. So we needed to add more about care of the critical needs, the critical care patient. So a lot of different things, and eventually your curriculum just gets bigger and bigger and bigger and bigger, and your instructors are saying, oh my gosh, I only have so many hours to teach. How can I possibly go over all this? Okay, so one of the trends that we've been seeing probably for the last 10 years or so in nursing education is moving to a concept-based curriculum. And I don't know how much you've discussed that in some of your courses, so I just want to talk about it a little bit. So typically the curriculum that we often see starts out maybe with fundamentals, med-surg 1, 2, OB, peds, maybe a critical care course, maybe a preceptorship, psych, community. It's kind of how we divide up curriculum in a traditional sense. Concept-based curriculum is trying to get you much more to think rather than memorize. Okay? So, there's a lot of ways to do this, but it's getting nurses to think about a process or a group of patients broadly instead of memorizing every single little steps of all these different processes and all these little details about patient groups. So let me just give you an example. In a program that I was teaching in, we were slowly moving to a concept-based curriculum, and we changed a few of our courses. So in fundamentals, we started looking at system processes. We had a unit on oxygenation. We had a unit on perfusion. Okay, so we really dug into the patho processes, first physiology, then patho. We used some exemplars, not every single diagnosis you can think of, and really focused on what does the nurse need to know when a patient has a problem with oxygenation, patient has a problem with perfusion. Okay, so we did those types of concepts and foundations. When we went to med-surg, we focused on nursing care of a patient with a neuro condition, nursing care of a patient with a cardiac condition. Let's start thinking globally. I hear a report, I've got a cardiac patient. What are the top things I'm going to think of with any cardiac patient? Then I'm going to use some patho exemplars to kind of bring out some things that might be a little different. So that was one way that we worked on starting to incorporate a concept-based curriculum. I have seen other things. I have seen across a lifespan curriculum. So they'll talk about cardiology and they'll go from neonate to geriatrics and talk about cardiology all along that lifespan. It's a holistic way of looking at it, right? I've seen programs focus on acute conditions, chronic conditions, and emergent critical conditions, caring for the patient in those types of healthcare. Interesting, just a really different way of looking at it. And the whole point is we're trying to get the nurse to think about, okay, I've got a general patient. What are all the things I need to consider? Not, oh my gosh, I have a patient, status post-stent. What do I remember about stents, in particular, this particular stent? I'm hoping I'm not explaining it very well, but I'm hoping to give you an idea. I'm going to be attaching 2 PowerPoint slide presentations. One of them is about from University of Kansas, and it is talking about their process in moving towards a concept-based curriculum. There is another one that the beginning of it isn't stellar, but it really gives you an idea of some different types of concepts. This was done for a presentation, but types of concepts that might be used in a concept-based curriculum. Okay, I think that's about it. I've started working on your week 6 NEPDs, and I will have them done definitely by the end of the weekend. I think that's about it, guys. As always, if you have any questions, just shoot me a note in your individual forum, or if you think everyone might have them, just send me a note in the questions for the instructor forum. All right, I'll see you again in the main forum.